Welcome back. It's time now for Medical Rounds. There are times when our caregivers need extra care, especially considering the toll COVID-19 has taken on healthcare workers and nurses. So here to talk about support available for nurses who might be experiencing physical or emotional burnout is Mandy Richards, Executive Vice President and Chief Nursing Officer at Hartford HealthCare. Hi, Mandy. Thanks so much for joining us.
Hi, thank you so much for having me today.
So we want to talk, what are some support options available to those nurses to help guide them through these tough times?
Yeah, thanks for asking. You know, anytime we think about nurses as caregivers, we also have to think about how do they care for themselves. And so fortunately at Hartford HealthCare, we're one of the few organisations that have a Chief Wellness Officer and a department dedicated on the well-being of our colleagues and our nurses. So just three quick things that we've been doing for our nurses in the last couple of years during these challenging times. It starts with training our leaders. So how can our leaders be more focused specifically on how do they support the team? And so giving them the skills and information they need to lead during a crisis was really important. That helped to build the cohesiveness of our teams so the teams could actually support each other. The second thing we did was launched a wellbeing index tool. And so that was a tool that nurses and all colleagues could access on their smartphone or on a computer. And it was a once a month tool that they could do that would provide immediate information on and gave them relevant resources about their own distress and wellbeing. And it compared their results to those in similar roles across Hartford HealthCare and nationally. And so it was a check-in of sorts as to how they were doing. And actually, since we launched the tool in October, nurses have been our colleagues that have used it the most. And so for me, that's knowing that they're taking a moment to pause and check in on their own wellbeing, which is fabulous. And then lastly, we launched a nursing peer support program, which I'm really excited about, which is where nurses can reach out to a peer, a nurse, and talk about what they're struggling in real time.
Great. So let's talk a little bit more about that peer support program. Who are peer supporters and what do they do?
Yeah, so often, you know, it's those that have walked in your shoes that are the best ones to understand what you're going through. So peers is really important. And so the colleagues who are peer supporters are volunteers that are trained, and they're really there to walk through this difficult time with their colleague and help them build confidence, prevent burnout, and restore joy in the work that they're doing.
Wonderful. Mandy Richards, Executive Vice President and Chief Nursing Officer at Hartford HealthCare. We really appreciate your time. Valuable information. Hope everybody stays well this season.